Hi there. Welcome back to the Wellbeing Designers Podcast. I am your host, Reka Deak. On this podcast, I dive into conversations with well-being leaders from across the globe. These individuals might hold positions like head of well-being in large organizations. We have had guests on the show as well who are driving global change in this area and creating international forums to exchange on the topic of well-being. What unites them all? They want to make the world a better place through focusing on well-being. They might be the ones who are responsible for the well-being of hundreds, thousands, or 10,000s of individuals. They might be the catalyst to keep decision makers, CEOs engaged in this conversation about well-being. And they might be the ones who are proving that employee well-being is not just a nice to have, but it's truly a strategic enabler of sustainable performance and business success. I call these people well-being designers. They are the connectors bridging the gap between well-being leaders across companies and countries. So sit back, relax, and enjoy listening to these incredible individuals and learning from them. Remember, we can shape the future of work together, which is truly human-centric, and prioritize well-being like never before.
Hi everyone, welcome to this episode with 𝗵𝗵𝗴𝗵𝗵𝗵𝗁 Safir, who is the Chief Medical Director of Employee Health and Wellbeing at Johns Hopkins Medicine in Baltimore, Maryland. He leads the Healthy at Hopkins Employee Health and Wellbeing strategy. Rich has inspired the organization to integrate well-being into everything from employee orientation to executive leadership trainings. Yes, they have benefits and programs for well-being, but employees don't have to sign up to any well-being programs to be healthy and happy. It's woven into their everyday work life. Richard is also a public speaker and author who champions healthy workplace culture by focusing on 6 building blocks: leadership support, shared values, social climate, healthy norms, peer support, and culture connection points. His work has been recognized by the Center of Disease Control and Prevention, the Department of Health and Human Services, and the Governor of Maryland. He has been featured in the Washington Post, in Wall Street Journal, and in the Baltimore Sun. And he previously also sat on the board of the American College of Lifestyle Medicine and on the New England Journal of Medicine Catalyst Insight Council. He is a health enthusiast who enjoys hiking and camping in the Andes, Alaska, Australia, and across the western United States. He lives in Columbia, Maryland, with his wife, 3 children, and their dog, 𝗵𝗶𝗴𝗵𝗶𝗵𝗁. Good afternoon, Rich. Good morning for you. Very welcome on the Wellbeing Designers Podcast. How are you doing today?
I'm well. I feel well rested today. Thank you.
Very good. So you are sitting in the US, in Maryland, Baltimore.
Yes,
Am I correct? Yes.
that's correct.
And I am sitting in Switzerland, so we have some time difference.
Well, it's
So
been 30 years since I've been to Switzerland, so I'm happy to connect with you this morning, Reka.
yes, very, very nice. And everyone can see what a beautiful background you have in your picture. So that really reminds me of Switzerland. I should have this background myself. Yeah, but let's start then with you. So I gave a bit of an intro, your bio for the listeners. And we always go a bit deeper with each guest. What is, beyond this official bio? who are you and how did you get into this super interesting position that you are holding today, leading the well-being activities of Johns Hopkins Medicine?
Well, it's not what I thought I was going to do when I was a kid, and they ask you, hey, what do you want to be when you grow up? And it's like astronaut or cowboy. It's actually not what I thought I was going to be doing when I graduated from medical school. But in the first 2 years of seeing patients in a family practice, I was going from one patient to the next in 15 minutes. And it was frustrating because it wasn't enough time to make a difference with my patients. And then they were also rushed. They were either coming into my office from work or rushing back to their job. And I realized, light bulb, I need to be where they are. They're spending almost 2,000 hours a year at work, and I think I can have a bigger impact if I'm at the workplace. So that started my journey to Johns Hopkins Medicine.
Wow. You know, my grandfather was a medical doctor, like a general practitioner, a family doctor. And I think back then, especially in Hungary, the system was really different. You know, he had time to go to
Yes.
patients, to spend time with them. And it was a very, very, very different world. And, you know, connecting back to me and what I do today, I was recently asked who influenced my work. And suddenly I had a light bulb moment that it definitely, you know, something is there from my grandfather as well.
I'm not surprised. It seems to me that some way or another, our parents and our grandparents and other relatives influence us in so many ways. My grandfather was a licensed clinical social worker, and at the time, he wasn't allowed to go to medical school. There was some discrimination based on our religious background. So while I didn't at the time think that influenced me, later on in my career, it started to dawn on me that perhaps there was some impact.
And how did you then decide to then, in a way, give up that kind of medicine and then go into what you do today? So I know that it's always a bit of a dilemma for doctors, you know, how they serve the community.
Yeah, it was certainly a dilemma. I mean, when you go through that much school and then you realize you're not where you want to be, frankly, I was a little bit distraught. Before I went to medical school, I studied nutrition in college. And that education was helpful in so many ways. But beyond the help it provided me as an individual, while I was practicing medicine, I started to put the pieces together. Pieces like, hey, my patients would be so much better off if they not only knew more about nutrition, but about the community aspect of eating, the social connectedness that eating brings, how we eat when we're stressed, how not getting enough sleep makes us eat more and makes us choose less healthy food. My education in nutrition, while at first glance people think it's just about what foods to eat, it connects to all these other aspects of well-being. And so I realized that this is what's missing in most people's lives, is that their physicians don't have the time to help them with their general well-being and their healthy habits. And I knew if I could get inside a company that I would have a bigger audience for more hours a day, and I could make a more meaningful impact. And Reka, I don't know that we want to take my circuitous path because I had 4 jobs after leaving private practice to get to where I am today. But needless to say, every one of those stops along my journey contributed to my pretty comprehensive view of the healthcare system and how we as individuals are impacted by so many different pieces of the healthcare system in so many different ways by the employer, that I believe I've been able to put together a pretty good framework for how we can build a well-being culture on our work teams and across the entire organization that supports every employee's well-being journey.
Yes, and that will bring us also to your book, right? The Cure for the Common Company, the Wellbeing Prescription for a Happier, Healthier, and More Resilient Workforce. I am very, very excited to talk about that. But let's just, not rush so much to the present, because you published this book basically in 2023. But
Yes.
let's, go back where you also mentioned that you had several jobs until you arrived at Johns Hopkins. So how did you then start your mission at Johns Hopkins, and how the system really enabled you, or did it really enable you, or did you have to, create your space? That would be my
Right.
really the
Right.
question.
So by the time I had gotten to Johns Hopkins Medicine, I had already been studying employee health and well-being. I had also been leading an occupational medicine office. I had been working at one of the large Blue Cross Blue Shield insurance companies in the capacity of helping employee health and well-being and advising companies in this capacity. So I pretty much thought I knew what I was doing. And yet, when I was hired at Johns Hopkins Medicine, I was hired as the medical director of our own health insurance plan. And it was a very traditional nuts and bolts role that was lacking any strategy to support the health and well-being of the workforce. It was much more about how are we going to manage the people who are already sick without consideration of how to keep people from getting sick. And even those who are sick, what can we do to support them to make healthier choices so that we're not just relying on drugs and surgery? So, Reka, my way of thinking was not in place when I arrived at Johns Hopkins Medicine. Now, Johns Hopkins Medicine does a great job of caring for the patients in our community and even people across the world. But up until about a decade ago, we really weren't thinking so much about how we're going to care for ourselves. So everything that I did those early years required a lot of selling. I really had to make the case as to why this was the right approach, and how did that support our business as well as our employees, and what were the resources that were going to be needed to move this ball forward. Now, if you want to know the first place where we stuck a flag in the ground, I'm happy to share that.
Yes,
that's okay.
absolutely.
I'm kind of queuing up a story here. You know, everyone needs a little time to get oriented to their new workplace. And after about 3 months of being on the job, I decided to take a walk around our main campus in downtown Baltimore, Maryland. And I was observing what was going on around us. It's a city campus, so I was observing the people in the community. I was observing the outside of the buildings before I was planning to go on to the inside and observe. And as I was deep in thought, I realized that I might have seen a fire truck behind me. And so I turned around, and it was a red truck, and I decided to keep walking. But something wasn't right. And I turned back, and what I saw was actually not a fire truck. It was a big red truck, but it was a big red soda truck. And I thought that was odd. And I just stood there looking at this big red soda truck outside our main hospital. And what also struck me as odd was that it was positioned behind the hospital, where there was a big E on a sign above the truck attached to the building. And it took me a second, but I realized this was the old emergency room. That's why there was an E on the sign. And that's why the truck was there, because it had been converted to a loading dock. And a light bulb went off again. I'm like, this is not a great sign. We're bringing soda into our hospital, and this is a place where we're treating people whose health has been harmed by soda. So the irony did not escape me. And I went inside the building and observed some things that made me conclude the first thing we need to do is address the soda problem with our culture. It was symbolic of the greater need for organizational transformation.
Hmm. I love the example, in more ways. Two things come to my mind. One is about Singapore. Singapore is a blue zone. I don't know if you know the Netflix series about longevity. And actually, they reduced the sugar level in sodas that they let into
Yeah.
the country. So this story comes to my mind. And the other one is, very personal one. We could have started with that. I spent 1 year in Baltimore back in 2006/7. I did a gap year during my studies to go for a work and travel because my English wasn't so good back then. I started to learn English quite late in my life. German was my first foreign language. So I ended up to work in a fast food restaurant and then in a hotel in Baltimore. And I also visited Johns Hopkins, it was kind of like a landmark. And that was my first time in the US. It was at the beginning of my 20s. And it really just hit me, that the level of sugar that people eat there. And the impact on their health and also the obesity. And it's not only the US, we have the Europe as well. But for
Yes.
me, coming back then, from Hungary, I also traveled a bit, but mainly back then within Europe. World more opened up for me during my studies, and then I finished it. Yeah, it was just really visible, and in a
Yeah.
way, sad that people eat so much sugar and processed food.
Well, your English is much better than my Germany, so I'm grateful that you came to the US and you learned English in our town of Baltimore. What strikes me as one of the more embarrassing things about being American is the number of unhealthy cues that we export to other countries. Now, there's a lot of great things about America, but as a health and well-being professional, I always feel a little sheepish meeting my colleagues from across the ocean because I know that there are some things that we have provided that have made it more challenging for people living in other countries to make healthy choices. So I apologize.
That's absolutely fine. We also get our good things from your
Yes.
country. Yeah, but let's then go back. That's a symbolic story. So basically, it could be interpreted also like a movement, how your movement started, that let's then have no soda or less soda and start a
Yes.
transformation in the company. So how did people then react, and how you proceeded with this movement?
So this is a good opportunity to share with our community how important it is that us as health and well-being professionals also get comfortable with organizational change. Because if you're in the employer space or the organization space, we really need to go beyond just individual behavior and individual mental health and understand that if we can certainly address the individual, but also address the wider organization and culture, that we're going to be much more effective in our efforts. And Reka, this required a lot of planning, which some health and well-being professionals embrace this idea that you really have to invest up front. But I think that not everybody recognizes and they really want to show something quickly. But in this case, it was really important that we look at some of the steps for organizational change and put the infrastructure in place before proceeding forward. So just figuring out who to partner with inside our organization when I had only been there for 3 or 4 months, that alone took some time and energy. And then, of course, making the business case and figuring out the pieces and parts, including how we were going to operationalize our effort, how we were going to measure our effort. all of these things took some time before actually starting the change itself. It was a 3-year transformation. And many of our projects, because we're not just in Baltimore, but we're across the state of Maryland, in the District of Columbia, Northern Virginia, we even have a hospital in Florida, can take time. Now, I am happy to say most of what we do now doesn't take 3 years because we've really gotten the pattern down. But my point being, if you're working in a large organization, just recognize you need to pace yourself. And in my opinion, it's much better to put the work in up front before you go and proceed, because if you take a wrong step early in the process, it could really set you back.
Yes, absolutely. And, coming from management consulting, a lot of transformations myself, I can totally support that. Stakeholder management, bringing people on board, that's key to any transformation, especially such a transformation which really goes deep into people's habits, right? People can feel even, personal about it. Oh, do you take away my soda? Like, do you have a right for that, right? It's not about using another system, I don't know, new system instead of SAP, or that might be, even that can take, go into emotions. But yeah, this is a different one. And again, remind us how many employees your organization have. So
sure, we're 40,000 employees, and
yes.
I want to touch on, you raised the issue of emotions. Yes, people want to have control over their own decisions, and we absolutely respect that. And certainly our employees can eat or drink whatever they choose. And as an employer who wants to support the health and well-being of our workforce, we made it easier to choose the healthy beverage by increasing the number of healthy beverage options, by making sure the healthy beverages are at eye level. So that's the first thing you see when you go up to the refrigerator case or the vending machine. We made sure that water costs less than soda. And we also put a green leaf in front of the beverages that are the healthiest. So we injected some behavioral economics into our strategy so that our employees could much more quickly choose the healthy beverage. And we did not take away all of the sodas, but we did reduce the number of them.
Yeah. And, now we took out this example of the sodas that you talk about also well-being culture, which has much more elements than, I guess, the physical and within that nutrition and the soda. So could we go a bit then deeper on the overarching strategy that you have right now? And also maybe that you have back then, how did that change? How successful then the transformation was, this 3-year transformation? And then how did you get there where you are today?
Sure. So, the healthy beverage campaign was really a strategy within a broader strategy, as you alluded to, which is to create a workplace culture that supports health and well-being. Now, we have 40,000 employees, and every person is different, and we cannot create 40,000 different strategies. That's just not practical. So we aim to create a supportive work environment so that each of our 40,000 employees is much more likely to have a healthy and well workday if they choose to. And that requires putting in place 6 well-being culture building blocks. And I'll go into them in a minute if we'd like to explore them. But I think the point is that, we're at the workplace for 8 to 8.5, 9 hours a day, whatever it is. And we can't just abdicate our well-being to a half hour at lunchtime. We really need to figure out how it's going to be woven, intricate, integrated, however you want to say it, throughout our day to optimize our well-being. You alluded to the blue zones earlier, Reka. I'm very familiar with the blue zones for more than a couple of decades. And there you have 6 communities around the globe that had some very similar cultures that helped support an unusually high number of citizens living past the age of 100.
Mm-hmm.
And it required the people in those communities to have shared behaviors, beliefs, and attitudes that all pointed towards a healthier and longer life. Now, we can create or we can shape those shared behaviors, beliefs, and attitudes in the workplace, but we need to be intentional. And that is the core of our strategy at Johns Hopkins Medicine.
What are those 6 building blocks that you mentioned?
Sure. So I'm going to give a phrase, plan for success, and then I'll explain or list the 6 building blocks that are in that plan for success. So the P in plan is for peer support. The L in plan is for leadership engagement, not support, but engagement, and we'll come back to that maybe. The N in plan is for norms, the expected behavior of a group of people. Skip the word for and move over to the last word, success. The first S in success for social climate, the 2 C's for culture connection points, and the last S for shared values. That's why I have a word, plan for success, because trying to remember 6 building blocks might be a little bit more challenging than the plan for success phrase.
That's super interesting, and I will just repeat in a moment all 6 of them so the listeners can capture it, because many companies nowadays, they work with this like typical well-being framework of physical, mental, social,
Yes.
financial,
Yes.
and now other areas are coming up because it's, as you said, it's not only about the individual, it's also
Yes.
about the community. So
Yes.
how and the ways of working. So
Yeah.
it's not a
Yeah.
one-time activity, half an hour during the day, but throughout the day. So I am really curious, how you then came up with this and how you
Yeah.
then still integrate those
Right.
the soda, the
Right.
soda
Right.
one.
So
But let me just give an overview so the listeners can capture it. So based on your book, the key ideas, which are also similarly the building blocks, are then shared values, social climate, norms, culture connection points, peer support, leadership engagement, and navigating speed bumps. Right?
you mentioned the different types of well-being, like social well-being and financial well-being, and I'm all for those. And regardless of which area of well-being you're trying to focus on, if you use this well-being framework, you're much more likely to have a more robust approach that's going to help more of your employees and help them more deeply and broadly. And I know this to be the case, not just because of the science, but Reka, I started this journey 25 years ago. And when I started, I didn't know everything. I still don't know everything, but I've learned a lot. I've learned what has worked, and I've also learned what hasn't worked. I've made some mistakes along the way, which really taught me, and it's helped me understand that there's some powerful forces around us that are influencing our physical well-being and our mental well-being, etc., that we often overlook because they're not a traditional, they're not part of the traditional framework.
I would love to hear some of these mistakes or failures. So I think it would be really interesting to know if you are okay to share about them.
Oh, sure. I mean, there's some very common ones that I'm guessing many of the listeners here can see, if they've been doing this work for some time, just take any program that you've offered your employees. So let's take nutrition. If you're trying to help your employees make healthier food choices, and you're offering them a webinar or a class, some of the more common and easy to provide resources, you're really not likely to make a big impact, if any impact. I mean, just think about it. We all know that apples are healthy, and some of us eat apples, but the people who went to the webinar or the 5-week series about the importance of fruits and vegetables, if they're not getting the support in the workplace to make those healthier food choices, it's really going to be hard for them to change their behavior despite their best intention. And so what I mean by that is, are we setting them up in their teams so that the manager's not bringing a plate of donuts and putting it on the table during the meeting? Instead, are we bringing a bowl of fruit to snack on during the meeting? Is the cafeteria offering fruit at the checkout line, or like is commonly done in grocery stores, they putting candy at the checkout line?
Yeah.
Does the fruit cost less than the candy bar, or is the fruit just too expensive for them to choose? And maybe if you're living and working in the city, maybe your employer would make a good effort by selling fruit in like a little grocery store type of setting, so that people can more easily take the fruit and vegetables home to their family. We have to think more broadly. We have to think about putting the resource and infrastructure in place so that it's easier for our employees to make these healthy choices, and that we're not just telling them what the healthy choices are.
Yeah. That's absolutely the case nowadays. I think you started this journey quite a while ago at the companies who are maybe, just starting now. They often start with the webinars, and then they realize that there is a next step after that. So I am also supporting some of them to then amplify the learnings, because it's still important, very important what they learn there.
Yes.
But then how then they really make this as a habit, build it into their everyday life. Let's continue with some other examples. So I would be really curious, what are the other programs that were maybe the one that is not connected to nutrition, but mental health, or some other parts that you are, the most proud of, that was really, successful and made an impact on the employee's life?
Sure. I mean, there's a few things that we're pretty proud of. You mentioned mental health. I'll tell you that we have a pretty good mindfulness strategy, where we not only offer mindfulness programs and a mindfulness app at no cost to our employees, but we have integrated mindfulness into our workplace culture, meaning that we're working with entire teams on mindfulness. We're reminding our workforce about taking a breath during the workday. We've even put it into our orientation for new employees. That's how important it is for us to help them understand at the very outset about how powerful taking a healthy breath or doing a 4-7-8 breathing pattern can be in reducing our stress quickly throughout the day. And this is not something that is typical for most employers. So I feel pretty lucky that we've been able to both get the resources and use the well-being culture framework to integrate it into the workplace culture.
And two questions. How is your staff, let's say also doctors, nurses, reacting on this? I guess you leave them space, to choose what they want to pick, what is the best.
Oh
And
yeah,
then
yeah,
how
yeah.
are also patients, reacting on this? Because in your case, it really has a multiplier effect, what doctors choose themselves or nurses or
Sure.
other staff,
Yeah.
and then how they then treat those patients.
So certainly everybody who works at Johns Hopkins Medicine has their own choice for how much or how little they want to participate in what we have to offer. But honestly, what we have to offer is simmering in the background. So even if one of our employees chooses not to participate in any of the mindfulness resources that we have available, they're still benefiting from their coworkers who are becoming more mindful, who are becoming less stressed during the workday. Because as you know, Reka, our emotions travel, right? And when our coworkers are less stressed, it makes it better for us because then we're not picking up their stress.
Exactly.
So we purposely offer programs that are whoever wants to come to as individuals, but we also offer them to teams so teams can work on this together. It makes it easier to build a team norm. That's one of the building blocks. We have leadership engagement. In fact, a few months ago, our entire health system has a quarterly town hall meeting, and it opened with a 4-7-8 breathing practice. So we can demonstrate how our leaders support this. So there are multiple ways in which this is permeating throughout our organization. So there are some doctors who would like this service, this practice, and we have supported some of the retreats for some of the medical departments. Some we have not. Same with nursing. And so I would say we're looking at this not as you are a doctor or you work in food services, but you are a person. And if you want to embrace this, please, we're here to help you. Now, Reka, I can honestly say that we don't know how this is impacting our patients. We know from the literature, when there's been controlled studies, that when patients are treated by a staff that is happier and more calm, they benefit. So we have to surmise or conclude that for those members of our workforce who are happier, healthier, more relaxed, then the patients that they're serving are benefiting from that.
Yeah, and I totally get it. It's such a complex system that
Yes,
even if you say that you are more popular as a hospital, as a healthcare provider than another one, how much does it really depend on the doctor and the doctors and how they, behave, well-being?
absolutely.
Yeah, it's still, what is your measurement system? Maybe not, something regarding to patients, but within the company. So do you, for instance, have to report on the work that you do,
Oh my
on the
gosh, we report a
impact,
lot.
KPIs? Yeah.
We
So if
report a lot.
if you
So
could
some of our
share a bit.
reporting is pretty easy, like participation, and some of our reporting is a little bit more complex, and then there's something in the middle. So like in the middle would be getting feedback from our employees, which is really important to us because as you know, well-being is very personal. And so the only way for us to know how our employees are doing is to know from them how they're doing. So we have 3 questions in our engagement survey. One is directly related to whether or not our employees feel that the employer cares for their well-being. One is related to resiliency, and one is related to work-life balance. Reka, we also have a culture of health survey that we ask our employees 2 questions for each one of our 6 building blocks. 2 questions about peer support, such as, do you have a colleague that can support your health and well-being needs.
Mhm.
One is that there's 2 questions about leadership. There's 2 questions about team norms. I mean, we take this feedback very seriously, because when we find where we're weakest, then we can focus our attention on that area. And then on the more complex end of the spectrum of measurement, we look at blood pressure for those employees who participate in our blood pressure program, and we can measure the blood pressure year over year by matching the cohorts. And so that gets a little bit more data heavy for our measurement. And we have, we have so much data. It's really
Yeah,
important
yeah,
for us to have data in order to show where we've come from and to figure out where we need to keep working on.
yeah. I guess these surveys are also anonymous, or do you
Oh,
still in the back,
absolutely. Yes.
do you
Yes.
match the person's blood pressure and what kind of answers they give, for instance, with peer support? So is that, connected, that
Right.
that's one person?
So we have a third party that does the examples I just gave you are collected by a third party.
Mm-hmm.
If we have something like participation and we're not working with a third party, we'll just measure participation ourselves. So we've got a variety of things that are measured by a third party and some things we measure internally. But the ones I shared with you are measured by a third party, and they match up the cohorts, because we don't want to know, so that our employees can feel more comfortable.
Mm-hmm, mm-hmm. So you still then have within like a cohort some idea about how people are feeling physically based on a blood pressure and what they report as a peer support. So you can say that maybe people who have
Yeah.
a higher blood pressure, they are more stressed and they also don't get so much peer support, and then you have a correlation.
Well, we can make some hypotheses based on looking at the data together.
Yes.
And listen, even in our blood pressure strategy, we work toward helping employees understand the value of finding a coworker who also has high blood pressure and working together during the day to take breaks and keep moving, to work together to make sure that their stress is lower.
Yeah.
We do this through a variety of messaging, but also we have a 9-week lifestyle medicine program where we get a cohort of 100 or sometimes 200 employees in the spring and in the fall. And during the first session, and they're reminded later, during the first session, hey, if you've signed up with someone, that's great, because we want you to work together. And if you haven't, identify someone that's here and work together throughout the program, because it's going to help you succeed better going forward.
Yeah. That's super interesting. More and more companies go into this, how community support can help and support well-being. So I am sure some listeners will find it inspirational what you do. All right, so we are close to the end of the podcast, and I still have 2 very important questions. One is, what is your advice for future well-being leaders, either in the medical sector or, beyond, like on corporates?
So beyond what I've already shared, I think it's important that new emerging leaders, if you want to continue to be a leader, learn about the social sciences, about how people impact each other's well-being, both from an emotional level as well as a behavior and choice level. That is something that's probably not taught very much in health promotion curriculum, in MPH programs. I do a little teaching, Reka, both at our School of Public Health at Johns Hopkins University as well as American University. And it's not something that I came across very much when I was learning along the way to get to where I am today.
Yeah, that's so true. And it goes hand in hand, exactly what I said as well about this community support. So I think this might be the next big thing in well-being that is already there and it is coming.
Well, people
Oh,
are recognizing that social connectedness is important for our own health and longevity.
yeah.
But I agree that organizations have not yet recognized how social connectedness plays a role in mental health and in making healthier behavior choices. We have a huge amount of potential ahead of us for us to collectively do better.
Yeah, absolutely. And still, yeah, we are pretty much there at this individual well-being
Right.
initiatives, also in corporate. And now
Yeah.
it's coming that we start to think more on connecting the dots between individuals. And as you say beautifully, also in your concept of well-being culture, I am using that as well. It's all about then the community and the teams and the whole organization. All right. The last question is about you again. We circled back to you as we started it also with you and your journey. So you are a professional, busy professional, pioneering some transformational work at one of the biggest healthcare organizations in the world. You are a father of three. How do you take care of your own well-being?
Well, my well-being's been a journey for sure, and I have to say I'm a recovering type A individual. Type A meaning very like I need to do this the right way and what have you. And I'm really focusing and have been for about 5 to 7 years now on my stress level. And my journey actually started probably 25 years ago when I was in that family practice, which was probably the height of my stress level. And during that time when I was having this reconsideration of my career path, it was also being prompted because the pace at which I was working I knew was not healthy and it wasn't good for me. And so, Reka, I've gone from yoga, and I still do yoga. And 5 to 7 years ago, I went to a 5 day mindfulness-based stress reduction retreat. And that changed my whole perception and practice of mindfulness. And now I'm learning about our heart rate variability and how the heart, the magnetic waves from our heart and our brain are connected. And as I say this out loud, and I know this is going to be public soon, it just makes me feel like, wow, I'm out there. I went from being a nutritional biochemistry major, yes, like on the molecular level when I was studying in college, to now talking about the heart-mind connection. And I'm happy I'm on this journey because I feel like the more I learn and the more I enhance my practice, the more relaxed I've become.
That's beautiful. Thank you for sharing. And we need more and more people like you who share about this. And exactly what you said, mind, heart, body connection, it has been there in many cultures through the history around the world, but it feels like that we lost it on the way in the Western culture. So now we are coming back to it. Yeah. So
And Reka, I have to say this is the first podcast where I'm sharing that openly, that's where I am currently today.
oh, thank you. That's really an honor. And thank you so much for your all the knowledge, your experience that you shared, and for all your work that you have been doing in this well-being space. I am sure many, many listeners will be inspired by it and happy to follow your journey and maybe see you again soon in the next years.
I hope so. And Reka, thank you for allowing me the opportunity to share some of what we're doing at Johns Hopkins Medicine with your community. And thank you for helping so many other companies because there's a lot of need out there.
Thank you, Rich. Have a great day and we see each other soon.
You as well.
Ciao.
Take care. Bye.
I hope that you found this conversation as insightful and inspiring as I did. Don't forget to keep up with us on all major podcast channels, including YouTube, Spotify, or Apple. Hit that subscribe button to express your support and be notified about the latest release of the podcast. You can also connect with us on social media. We are there on LinkedIn and Instagram. Search for Wellbeing Designers. And you can also ask directly questions from me or just say hi via my email address, hello@rekadeak, REKADEAK.com. You can also visit our website, www.wellbeing.design, or my personal website, www.rekadeak.com. And remember, if you are interested to explore the services of Wellbeing Designers, how we can support you and your organization to prioritize well-being and create a human-centric work environment, then again, reach out and visit our website. Together, let's continue shaping the future of work, which is truly human-centric and prioritizes well-being like never before. Thanks for tuning in. Until the next time, take care and be well.